It was the year 1854, and the British government was entrenched in a bloody battle called the Crimean War. Florence Nightingale served as a volunteer on one of the floors of the wards where the soldiers were brought after they had been injured on the battlefield. Unlike women of her generation, she had been educated, and what she witnessed inspired her to pen a letter to the British government in which she wrote, "If you had wanted to create a place worse than hell, you have thus succeeded." For what she saw around her was that the soldiers were not dying from the injuries they sustained on the battlefield, but were dying from the death, disease, and infection that seemed to follow the physician from the bedside to the bedside to the bedside, as he did not wash his hands nor sterilize his medical equipment. Conventional medical practice of the time believed that if you could not see it, it did not exist, and that germs were simply a figment of one's imagination. But Florence Nightingale knew something was fundamentally wrong, and without the support of her physician colleagues, she implemented a policy of hygiene and sanitation among her support staff. She had to be meticulous in her documentation, in her notes, and her follow-up to prove that washing one's hands and sterilization of medical equipment not only decreased rates of death and disease, but the centuries-long conventional medical practice had been wrong. Florence Nightingale challenged conventional medical practice. She challenged the status quo to found nursing. And she officially led medicine out of the dark ages of practice and forever fundamentally changed the future of science, history, and medicine with the establishment of the profession of nursing. Today, there are nearly 19 million nurses worldwide and 4 million in the United States, making up roughly half of the US healthcare workforce. Every day, nurses stand on the front line between life and death of patients, handling hundreds of thousands of dollars of highly complex medical equipment, technology, and medications to keep a patient alive the many hours a day a physician is not by the bedside. Every clinical interaction begins with and ends with the nurse, and nurses are the end user of nearly every medical product on the market. However, nurses are rarely, if ever, engaged in the decision-making process of which products are to be brought forth into the healthcare system. I can't tell you the number of times as a nurse new products were rolled out that were supposed to decrease our workload but actually made more work for us. Let me give you an example, something like this stethoscope. Only kidding, they really didn't give us that stethoscope. But many of the devices that they rolled out had a similar impact onto our workflow. Let me give you an example. When I was a floor nurse, our hospital decided to roll out this new device to help us with communication. So we took this device, put it around our neck, and off onto the floor we went. Suddenly, this device started screaming at us. "Dr. Smith is on the phone. Your blood products are ready. The IV is beeping in room 16. Your new admission is here." By the end of the first week, we'd all taken this device off and put it at the front desk, explaining to our manager that had not at all helped our workflow, but significantly complicated it. Eventually, the hospital brought back out this company to work with us on the design of the product. But from that moment forward, I wondered, what if they had engaged with the nurse at the beginning of the design process? How this would have driven down healthcare costs and increased productivity. Because the truth is, nurses are natural innovators, and they know where all the inefficiencies are in healthcare. Research studies show that nurses do 27 workarounds per shift and are in 36 different places over the course of an hour. That means nurses are innovating in a highly inefficient healthcare environment, 27 times a shift. They're MacGyvering the medical devices and the products on the hospital floor to better serve the needs of their patients. The challenge is, workarounds are not considered a good thing in nursing. They're not recognized as innovation. They're seen as skipping over policy and procedure. Unlike places like Google or Amazon, where employees are rewarded for identifying inefficiencies and fixing them, nurses run the risk of losing their jobs. So instead of driving forward innovation, coming up with new ways to deal with the inefficiencies they see around them, nurses keep them secret, and we keep living the definition of insanity, which, according to Albert Einstein, is to do the same thing over and over again and expect different results. The truth is, we must embrace a culture of innovation whereby frontline workers can bring forward their innovation. For innovation is the moment between stagnation and progress. Innovation is the impossible, the unseeable, the unbelievable, the unattainable, until it is the possible, the believable, the attainable, the seeable. We must cultivate programs and environments that support those who want to drive forward innovation, as opposed to environments that keep supporting insanity. And I have one idea: hackathons. And I think it's time I tell you a bit about my story, for it wasn't very long ago that I didn't know what a hackathon was or how that one weekend would change my life. A few years ago, I was a struggling nurse entrepreneur, and a friend of mine, also an entrepreneur, said, "Rebecca, you should really attend this healthcare hackathon." I had never heard of a hackathon, so he explained. It was this 3-day event where people got together, posed huge problems in healthcare, formed teams, and over the course of 56 hours came up with solutions. I was sold. I showed up at the event, and the room was full of physicians, medical students, engineers, and healthcare executives from all over. As I walked around the room looking for my fellow nurses, I realized I was the only nurse there. And for the moment, I thought, oh, I'm not supposed to be here. For you see, as a nurse, I was never invited to an event where healthcare executives were creating solutions to healthcare's biggest challenges. And I wondered, was I not supposed to be in this room? But nobody asked me to leave, so I ended up joining a team. Over the course of those 3 days were the most inspirational of my nursing career. Suddenly, the door opened, and a chief executive from a major hospital, healthcare company, or startup would walk in the room and sit down right next to me. And what I started to realize as we engaged and talked with them, for the first time in my nursing career, these healthcare executives were genuinely and authentically interested in my knowledge, insight, and opinion as a nurse to solving major healthcare problems. Over the course of those 3 days, I learned more about the business of healthcare than I had learned in an entire year of trying to start a healthcare business. And I left so inspired that I studied the environment of healthcare hackathons around Boston. And what I learned was that a very small percentage of nurses were attending those events, but a vast majority of the teams had nurses on them. So I hypothesized, nurses have the practical bedside experience to create great solutions. But even more than that, they were fundamentally necessary in the process of innovation by which to create great healthcare solutions. And in that moment, I knew that there had to be a nurse hackathon. And lucky for me, I picked up the phone and connected with Dr. Nancy Hanrahan, who was the dean of a leading school of nursing at the time. I explained to her my experience at this hackathon, and she said, "Rebecca, I'm running this summit on innovation and entrepreneurship next year. Why don't you run a hackathon?" And I said, "Well, I've been to a hackathon. Sure, I'll run a hackathon." I joined a team of incredible volunteers, and for the next year, we worked tirelessly towards this event. The truth is, we had no idea if anyone would show up or if anybody would believe that nurses should be innovators. In the last 3 decades, there had been less than a handful of articles that even mentioned nurse, innovator, and entrepreneur in the same article, nonetheless the same sentence. Suddenly, 2 weeks before the event, we were sold out. 250 people were attending, and every major Boston hospital was sending a team of nurses to attend the event. Dr. Hanrahan called me and she said, "Rebecca, what's next?" And I said, "I don't know, Dr. Hanrahan, what is next?" And she said, "We can't just introduce nurses to the ideas of innovation and entrepreneurship and leave them without support. I want you to come on as the director of innovation and entrepreneurship." And I said, "What program are we going to model after?" She's like, "There is none. We'll build the plane as we fly it." That was June 2016, and for 2 years, we built the leading program of innovation and entrepreneurship for nurses in the country. We participated in over 36 different innovation events, and had over 18 publications written about the work we were doing. It led to the first time in the history of the American Nurses Association to appoint their first vice president of innovation in the institution that's been around for 200 years. And it also allowed Johnson & Johnson to pivot their 15-year campaign of recognizing and thanking nurses for their service to recognizing nurse innovators across the history of healthcare. We had started seismic change in the world of nursing, and the truth is, perhaps the best chance we have at saving the future of nursing. For the reality is, nursing is facing unprecedented challenges. In the past 2 to 3 years, we've had more nurses on strike than we have seen in decades. The average age of a nurse in this country is 50, and 70% of nurses are over the age of 40. However, the most concerning and significant statistic that you may not be aware is that up to 50% of our new nursing graduates leave the bedside within 2 years of practice, the largest exodus from any profession. We are facing, with all combined factors, a nearly 1.25 million nursing shortage between the year 2020 and 2025 just in the United States. If we do not fundamentally change the way we have been engaging nurses in healthcare, the predictions we fear the most will become reality, and there will be no nurses to care for our sick and dying. But Florence Nightingale seemed to know that we were going to face significant challenges ahead in nursing and in healthcare, and she left us with this guiding principle. She said, "Were there none in the world who were discontented with what they have, the world would never reach anything better." And what that means to me is in that moments of greatest challenge and despair, there is the opportunity for great change. Were there none who were discontented, they would never create the change or the innovation the world so desperately needs. The answers to our current healthcare challenges will not be solved by the status quo or conventional practice. The answers to our challenges will be found in those who embrace and cultivate a collaborative environment of innovation to drive forward and advance healthcare for all. Thank you.